breathing problems, or they're going to take care of a patient who's suffering with pain. All of the terrors that the patient has been dealing with through the day or through the night focus down on, I didn't get my pain pill. But most importantly, there needs to be a spirit of cooperation, collaboration, and understanding that exists from the top of the treatment team down to the bottom layers. And people are working together to try to get this patient improved rather than people acting out whatever their particular conflicts are around their professional identities or their happiness or unhappiness with the system.
In the case of children with critical illness, it is their parents who must advocate for them. This can generate enormous conflict between doing what is best for their child and what is least painful.
Every time they needed blood, which was very frequently, they would do a finger stick, which is really not a small thing. I mean, it seems like it might be a small thing, but I think even most adults are really very afraid of having their finger poked like that. And I was in the room when a lab technician the first week came in to get the blood, and I really thought I couldn't stand it. I mean, absolutely couldn't stand it. And really just thought he just can't go through that. So we spoke to our oncologist, and we asked him if the blood couldn't be drawn through the Hickman catheter rather than by finger stick. And fortunately, he said yes. He was willing to do it. I think because we were medical people. But if he had not been willing to do it, we probably would have had a big fight.
I think the most difficult thing as a parent is to be barraged by your child who doesn't want to do what you know they have to do. And it's harder and harder to keep asking a child to do that when you see that their survival is really not going to be prolonged, when you see that the outcome is really not going to be there. And your terrible ambivalence of attempting to go for the gold at the time that you know that you're not going to in any way reach that. I think this difficulty for parents is overwhelming.
Now, if a patient with cancer has pain, the caregiver and the patient and the family member should not be satisfied. And they should be always asking questions as to why, and we should just never accept the presence of pain without feeling what more can we do?
The caregiver's most awesome responsibility after the diagnosis is helping the patient confront the last phase of the disease. By guiding the patient from health to illness and from illness to death, the doctor can forge a bond of support so needed on this painful journey.
But the dialogue is so difficult, because how do you sit with someone that you've taken care of and say, it doesn't look like anything's working? We often can say that. But that's very different than saying you are dying. And we often don't say that to patients unless they ask us. And even when they ask us, we often dance around the topic because we don't know how to do it well.
I think I could have benefited, and I think most doctors could benefit from some spiritual training. Because it certainly is important that at that state that we function as a rabbi or a priest, even though there may be a rabbi or a priest around. I think the patient may look more toward the doctor.
To talk to patients who are dying. Doctors are often doing this day in and day out, and everyone brings to it their own experiences and their own view of dying and their own perception of the patient. And the fact that we can begin this dialogue with patients, I think, will make it easier for us.
I'm thankful I'm here. I really am. I'm going to be there for a very long time. And being here,
Where's it?
over the mountain, I'm going to be up in Gulf Heaven somewhere. But I really, I'm not ready to go.
The wonderful thing about Adelaide has been her remarkable adaptability. She knows that there's enormous uncertainty in terms of her long-term survival, and she's aware that she will ultimately die of myeloma. I think firstly she needed to be liberated from her pain.
I was ready to give up. I really was ready to give up, and you promised me, no matter what happened at the end or whatever, that I would never be in pain. You would see to it that I would never be in pain, and that's really kept me going.
I get the strong impression that you've gone from a situation where you felt that you were dying of cancer
Right.
to a situation now where you're very much living with your cancer.
Absolutely. Absolutely.
I have no expectations of curing Adelaide, and I will derive an enormous sense of satisfaction from knowing that her life has been so much the richer, not only for her but for her family as well. And when they look back on this experience, it won't be with this feeling of terror and dread and horrendous memories, but they'll look back on this period knowing that they were able to continue to maintain a life of worth despite living with a life-threatening and ultimately terminal disease.
I may be a person who, for whatever series of reasons, don't feel comfortable taking care of people who are dying. Fine. But then I need to recognize that and involve others in helping my patients who are comfortable in that situation. Not feel guilty about it. I got enough I don't need more things to feel guilty about.
The amount of suffering that some of these patients can bring into your life, or that they carry with them, is enormous. And to try to take all of it on one pair of shoulders is really what can precipitate burnout. I'm a very, very strong advocate now, or I've learned to become a strong advocate of sharing the burden of care for these people. I think that their needs are so diverse as to require a very broad spectrum of expertise. I'm not a social worker, I'm not a psychiatrist, and I'm not a clergyman.
Geez, I'm one person. If said before, if the high divorce rate doesn't teach me anything, it teaches me I can't be all things to even one other person, let alone patient after patient after patient. So I need a team.
If sometimes we just sit down and talk to our colleagues or the students talking to their peers, just mentioning that we all feel that way. We all have these problems. We all have these inadequacies. Allow us to go ahead.
Sometimes doctors, however unintentionally, distance themselves from patients who do not respond to treatment. These patients can feel that they have somehow failed their doctor and have now been abandoned.
I think it's such an important issue that we're not going to abandon them, that we're not going to minimize their symptoms, and that we should be responsible in providing them with a real continuity of care. The hardest thing we see is when a patient has been cared for by a physician for years, and then the disease and its treatment have failed, and the patient feels that that doctor's abandoned them and triage them off to someone else.
The biggest frustration that I see in these angry kinds of interchanges is that the doctors in this case, the nurses and the patients really are not communicating with each other. They are communicating about something else that is, that looks like they're communicating. So it's important to find out what it is that is the real issue. And the real issue, 99% of the time, is do you care about me? And do you really care what happens to me? And are you genuinely, do you want to help me in some kind of way?
But I think the fears also are fear of isolation, fear of abandonment, fear that my doctor won't have a bed for me because he says there's nothing more that can be done. Or fear of a bed with a parking meter on it. In other words, if I get in there, they're not going to want me in very long holding up that because I'm blocking a bed. Fear that my relatives won't visit me anymore. Fear that the nonverbal fear that we project when we go in the room. The patient who said, my wife used to kiss me goodbye on the mouth, and then I noticed that she kissed me goodbye on the forehead. Then a week or two later, she was squeezing my shoulder, and then she squeezed my hand, and earlier today when she left, she wiggled my toes from the end of the bed. And very perceptibly, he was picking up the progressive distancing that his wife unquestionably wasn't even aware of.
There are 5 essential skills or qualities that one needs to have to be a good doctor, I think. A doctor needs to have cognitive skills. He needs to know his business of medicine. He needs to care. He needs to have he needs to have communication skills. He needs to have the conscientiousness to follow up on things. And he needs to have a curiosity to pick up on issues and to follow them through, to want to know what's happening in the family, to not know how you're feeling, to want to know how you're coping. Take away any one of these qualities and you're left with suboptimal medicine. These sort of things aren't qualities that you expect in a good doctor. These are the sort of qualities that we have a reasonable right to expect from every doctor.
Many, many, many times, I think in my mind consciously about how Timmy's oncologist would call us back. And when Timmy was terminal, and it was time to let him go, because you can always do something nowadays to prolong somebody a little bit more. You know, he could have had another blood transfusion or something like that. It was our confidence in his oncologist. I don't think there was anybody else on earth who could have said to me, well, this is it, that we would have just accepted it. When he finally said, look, you know, you have to let him go. It was the year and a half of trust that led us to have faith in him.
I think the doctor's role is to be a catalyst for healing. And I think we have to see healing as embracing body, mind, and spirit. I think we have to realize that people can die healed.
Only when healing occurs can we again make our way forward toward a sense of renewal after the loss of a loved one, or a meaningful existence within the shadow of death. Ultimately, each of us must find our own way there.
It was almost 3 years before we felt like we were again kind of a regular family unit, that we were enjoying things again in a different way. And it was around that time also that we made a decision that we wanted to have another child, and did go ahead and adopt a baby from Romania. The boys were very opposed to us adopting Marissa, in fact. I think largely because they felt it was a betrayal to Timmy's memory. They saw it as trying to replace him, and they didn't like the idea that we were doing that. In fact, though, they have been able to really see that she is not him, that she occupies a different place in the family, and that she's, really brought a good experience to them as well.
But I think that it wasn't until we adopted her, which was 3.5 years after Timmy died, that I would say I really felt like I came back to life. And I think it really was something very powerful like that, like having a new baby that made a difference.
To pull us back
into life, so to speak.
I was fortunate. I mean, I had an incredible wife who prepared me for her death, as she did the rest of the family. I felt ennobled by my experience because I felt I did everything one human being could do for another human being. I felt our love grow through this situation. Her courage gave me courage, and we could continue, and then we went to another level of more courage and more love, and we went higher and higher and higher until I really feel we touched God.
And maybe the answer is that somehow the experience of needing to go, that this is part of life, of needing to go through the experience of being supported through something that is horrendous and that takes something valuable away from you. I don't know the theological explanation for these things, but in a very fundamental way, I felt God's presence with me like I've never felt it before. And I woke up one morning over this week, and I said to the nurse, I feel calm today. I had some kind of an experience through the night that led me to some sort of calmness that I feel. And I believe that's real. I don't think that's just a psychological reaction on my part. And I believe that's directly related to the fact that somehow I'm beginning to put together